Dear colleagues, my name is Professor Natalia Linkova. I am the head of the Laboratory of Molecular Mechanism of Aging of St. Petersburg Institute of Bioregulation and Gerontology. The theme of my lecture is your Gems Peptide cosmetic, justification of the effectiveness of application. Peptides as regulators of skin functions has 4 groups. The first group is peptides immunomodulators, includes thymic peptide, EDP, cristagen. The second group is peptide blockers of the neuromuscular transmission. The third group is peptides restoring extracellular matrix homeostasis. And the last group is multifunctional peptides. This is AED cartilaginous peptide, Cartalax, cat vessel peptide, Vesugen, and EDR neuroendocrine peptide, Pinolone. Your Gems cosmetic contains the unique peptide-antioxidant complex, which include ginseng extract and 4 free peptides. Your Gems cosmetic have some products: day and night face cream, face serum, eye gel, face mask, body milk, foot cream, face tonic, hand cream, petals under the eyes, and cloth tablet mask. So you can see your Gems cosmetic general characteristic. Thymic peptide and neuroendocrine peptide and ginseng extract has regenerating effect. Thymic peptide and cartilaginous peptide and cocoa butter has restoration of barrier and immune functions of the skin. 4 short peptides, ginseng extract and argan oil has antioxidant effect. Vasoprotective peptide cat, xanthan resin, carrageenan, glucose, sodium hyaluronate and argan oil has hydration or nozzle effect. So this is the investigation. We can see the effect of the peptide antioxidant complex on the respiration rate of human skin fibroblasts. The respiration rate of human skin fibroblasts was evaluated in an HCT test in vitro experiment, a study using a nitrazine tetrazolium dye. If the intensity of cell metabolism increases, the oxidative reactions are activated. Nitrazidium tetrazolium, after activation of oxidative reactions, turns it an insoluble dark blue compound, formazan. Formazan can be visualized under a microscope, and its contents in skin cells can be assessed. A 5, 10, and 20% concentration of peptide antioxidant complex increase the intensity of cellular metabolism and stimulate the regeneration of skin fibroblasts. The most effective was the 5% concentration of peptide antioxidant complex in this study. This action of peptide antioxidant complex is cosmetic can lead to the effect of exfoliation of dead cells, which stimulates the growth of young cells in the epidermis. It leads the increase of skin turgor and stimulates wrinkle smoothing. So we can see the effect of your Gems cream on blood circulation in the skin. The study involved 20 persons, 8 men and 20 women, 37, 64 years old. Your Gems cream was applied to the skin for 7 days. Blood circulation in the skin was assessed by thermal imaging, infrared thermography, which consists in determining the temperature of the surface of the skin. Your Gems cream improving microcirculation in the skin. Visibly, this was maintained on the increase of elasticity and hydration of the skin. Here we can see the effect of your Gems cream on the hydration of the skin. For determining the hydration of the skin, a double examination of volunteers aged 34 to 67 years old was carried out. Before applying the Gems cream, and after the fifth procedure of applying the cream. The water content in the skin was assessed by bioimpedance, electrical resistance of biological tissues. Bioimpedance of the skin decreased by 25% under the action of your Gems cream. This indicates an increase of moisture content in the skin. On this investigation is assessment of the lifting effect of your Gems cream. The study involved 25 people aged 35 to 65 years old. The lifting effect of your Gems cream was evaluated by the degree of reduction in the number of wrinkles per 1 centimeter square of the skin in the eye area. It was shown that after using your Gems creams on third and fourth hour, the number of wrinkles increased on 16 and 65%. The next investigation was the regenerative effect of your Gems cream on skin injuries, edema, hematomas, abrasions. The study was carried out after intense physical extension by terminal imaging method on the base of the accredited testing laboratory center of the Russian Scientific Research Institute of the Traumatology and Orthopedics named after Braden. The indicator of thermal radiation of the skin significantly increased after the physical extension compared to the control. The thermal radiation of the skin increased immediately and after 15 minutes of skin treatment with your Gems cream. The increased thermal radiation of the skin under the action of cream indicates an improvement in respiration rate. This reduced pain in the muscle and ligaments, promotes their relaxation. Volunteers 38 to 64 years old who received brushes absorptions during sport 1 day after applying your Gems cream noted a decrease in burning and pain in damaged areas of the skin. There was a complete healing of abrasions, removal of edema, pain, and disappearance of hematomas in the injured areas of the body on the third day. So we can see that in control group of patients, this effect was done only on the fifth day. So we can see the condensed action of your Gems cream during skin injury. Skin bioimpedance after getting injury decreased in 57%. Immediately after your Gems cream treatment and after 1 day of your Gems cream applying, we can see that bioimpedance increase on 17 and 30%. So we investigate the influence of peptide-antioxidant complex on the state of the antioxidant system in various age women. This is lipid peroxidation, superoxide dismutase, and glutathione peroxidase investigation. Lipid peroxidation is a cascade of reactions of the transformation of lipids with the partification of free radicals. Lipids are the main components of all cell membrane. Lipid peroxidation can lead to the damage of cell membrane, which is one of the mechanisms of pathogenesis of many diseases and skin aging. Superoxide dismutase is the enzyme which catalyzes the dismutation of a toxic superoxide radical. It can be produced during oxidative energy process into hydrogen peroxide and molecular oxygen. So it presents oxygen-consuming cells and represents the most important link of antioxidant protection. Glutathione peroxidase is the enzyme from the class of acid reductase, which catalyzes the reaction of converting hydrogen peroxidase into 2 water molecules. GTP neutralized a potentially dangerous form of the active oxygen. The study involved 35 middle-aged women. The volunteers of the main group underwent mesotherapy, injected into the skin of the face of peptide-antioxidant complex. Women in the control group received mesotherapy with saline solution. We can see that after 7 and 14 days duration of the study, with the peptide-antioxidant complex, the lipid peroxidation decreased on 67 and 77%. So we can see that superoxide dismutase activity increased on 58 and 32% after 7 and 14 days of investigation. Also we can see that glutathione peroxidase level increased after 7 and 14 days of peptide antioxidant complex applying on 27%. It was observed an increase of the intensity of lipid peroxidation by 25%, accompanied by a decrease in the relative antioxidant activity of blood plasma and the activity of ferment of antioxidant system in the control group. Those changes persisted 2 weeks after the end of the mesotherapy because the normalization of this indication occurred after 1 month after the damaging effect. So we can see that the reparation effect of peptide antioxidant complex was more early after 7 days of the investigation. The same investigation was done involved with 15 elderly women. We can see that the lipid peroxidation after applying peptide antioxidant complex decreased on 15 and 28%. So we can see that the superoxide dismutase increased after 14 and 30 days of investigation on 57 and 83%. And glutathione peroxidase activity increased after 13 days of the investigation on 32%. We can see that the antioxidant system of elderly women has some pathology, and after 1 month after investigation it was not restored. But when we use the peptide antioxidant complex, we can see the restoration of the function of antioxidant system of elderly women. So we can do the conclusion. Your Gems cosmetic contains unique biologically active components, the AED cartilaginous tripeptide cartalax, the EDP thymic peptide cristagen, the EDR neuroendocrine system tripeptide pinealone, the cat vessel peptides mesogen, and the ginseng extract. Those molecules have antioxidant, immunoprotective, stress protective, and regenerating effects on the skin and help to prevent its accelerated aging. Clinical studies have been conducted confirming the effectiveness of the peptide antioxidant complex, which is the main part of the your Gems cosmetic. So we can see that peptide antioxidant complex stimulates the metabolism of skin fibroblasts. The use of the cream with peptide antioxidant complex promotes the stimulation of blood circulation in the skin due to one of the active components, the cat tripeptide. Peptide antioxidant complex has regenerating effect. It reduces the number of wrinkles in the skin around the eyes during 2-4 hours after applying the cream. The cream with peptide antioxidant complex promotes skin rapid healing, which is accompanied by the decrease in the severity of edema in the case of skin injuries. Mesotherapy with peptide antioxidant complex restores indicators of antioxidant system of the blood. This normalizing effect of young and middle-aged women was detected with 7 days faster in comparison with the control. Peptide antioxidant complex restored the functional activity of the antioxidant system after mesotherapy in elderly women, whereas this not happened in the control. The antioxidant effect of peptide-antioxidant complex is due to the stress protective properties of its constituent, either peptide and ginseng. So we can do the practical recommendation of the use of your Gems cosmetic. The first recommendation is after correction of the consequences of the use of invasive methods of aesthetic medicine. A home care program has been developed with the use of your Gems cosmetic after the most common injection procedures, such as mesotherapy, biorevitalization, bioreparation, Mesoneeds, Botox, and many others. The decondensate stage is the application of your Gems tonic for 10 minutes. Anti-inflammatory stage is with use the your Gems tonic and your Gems daily cream. Restorative or regenerative stage include day care and evening care. Day care we can do with the help of tonic and day cream and eye gel of your Gems. And evening care is the use of night cream and tonic. So the second part of applying a Gem cosmetic is daily home care for any skin types and any age. This includes day care with your Gems tonic and day cream, and evening care, which includes your Gems tonic and night cream. Also, we can use 2-3 times a week mask your Gems with night cream and tonic. And you can use every day your Gems body milk for hydration of all skin in the body. Thank you for your attention.